now. Oh, we got it. Okay, excellent stuff. Superb. Okay, well, good evening and welcome to this Portugal Calling webinar from expatsportugal.com, the practical do's and don'ts of using the Portuguese health system. And who better to talk to us about that than Serenity's Dr. Michael Averbukh, and colleagues Sofia Costa and Rafaela Francisco. Good evening, Michael. I think you're in an exotic location, aren't you, tonight?
Good evening. Yeah, I kind of thought of breaking the routine, you know.
And where did you go?
Far away. I'm on the African continent. So
wow.
If something happens to me, it's not the lions, it's just the internet.
All right. It's good to know that you're a doctor in these sorts of situations, isn't it? Or maybe a doctor of technology, perhaps. Okay, well, thank you so much for being here. You're from Serenity, of course, the great case management company helping people connect with the Portuguese health system, their health insurance, the health system. And when you're new in the country, that is a real godsend, as many people I'm sure will say in the comments tonight, some of whom are already with you and very satisfied customers. For those who haven't heard about Serenity, and that's hard to believe, but just in case they haven't, could you just give us a very brief overview of what you and Serenity do, please, Michael?
Yeah, thank you. Thank you so very much. And I'm excited to be like from such a long distance and in a totally different place, but seeing everybody makes me feel at home. Thank you for that. What Serenity is doing is actually providing medical case management and medical concierge services. This is a very nice slogan, but what it really means on the everyday basis is that we are your right and left hands when it comes to helping you navigate through the public and private systems of health in Portugal. And I think that nothing better than having us through this webinar to understand what is our everyday looks like, what does our everyday look like, and people will probably understand much better how can we help. That's it.
Brilliant. Okay, and you've brought a couple of colleagues along with you this evening. Can we be introduced to Sofia and Rafaela as well, please? Sofia,
absolutely so.
First?
Hello.
Hi.
My name is Sofia and I'm a nurse. I work as a case manager in the Serenity. I know some of you might know me, others it's the first time, but we've been participating for some time also. So I don't know if I'm a new old face or not, but it's my introduction. I'm sorry.
It's great to have you here. It's always lovely working with you. So thanks for being here this evening. And Rafaela as well. We saw you on the breakfast show, and you're here with us tonight to join Sofia and Michael. What can I ask? What it is that you do at Serenity?
Yes, I'm a nurse as well. I'm Sofia's colleague. So I work as a case manager in Serenity. And some of our listeners also know me because of Serenity, and they are maybe my clients as well. So all of you know me from there.
Fantastic. Great to have you along tonight as well, Rafaela. Now, this, of course, is the practical do's and don'ts, and we're going to be illustrating this with case studies, of course, anonymous. And to do that, Michael, you have a presentation to work through, which will be illustrated by real-life case studies and how you've actually helped people, right?
Yeah, actually, the idea is to tell true stories and to give some practical advice. It's less about hey, we did that, we did that, we did whatever it is. Just don't get into those problematic situations. That's the advice. But I would appreciate, Carl, if you gave me the opportunity to share screen, please.
There you go. That's done.
Thank you so very much. So,
and of course, as Astrid says, please do get your questions into the chat, and I'll make sure those get to Michael and the team this evening.
All right. Do I have your permission to
go ahead,
sir?
Go ahead.
Okay. Here we are. Well, all of what we're gonna tell you tonight is based on true stories that the team lives each and every day. As I said before, this is our bread and butter. And the main idea is not to tell you heroic stories or whatever. The main idea is to provide you with some practical advice of what to do if. And like every time we have this small dilemma of what we're gonna talk next about, not to be too boring. And we chose to talk about that because on an everyday basis, the team sees people that perform mistakes. It's natural, it's human. The thing is that we see as well the consequences and the pain that people go through because of those simple, actually very simple and very very basic mistakes. It's being naive many times. And the main thing why we're doing that, our why of today, is that we can really help. And we can help by supporting, by providing the right advice, mainly providing the right guidance. So what we are about to hear today are several stories, true stories of our clients. We will of course not disclose names and we will not go into too much details, but it all happened. We did not invent anything. And I would very much like to take you to a short journey, several short stories that will put many things in the right perspective.
Perfect, thank you.
First one, this I like. This is one of my favorite topics. I think Carl knows that, because this is the topic of having an insurance. And many of our clients and many of your clients, guys from Expats Portugal, are ending up with the same story, with the same quote. I can almost see it coming and hear it coming. And the quote is always, what? Like, we bought an insurance in a bank or with a broker, and it was really cheap. It was really easy. Just they told us, here's your insurance policy, just do it. And we did it. And now we are having an insurance that actually, when we went to see a physician, apparently did not cover anything we had. And these are true stories. I mean, we had a story of a client of ours that went to perform a surgical intervention, a complex surgical intervention. It ended up costing about 30,000 euros. He had an insurance by Medish, and I'm sorry, I'm not against Medish, I'm not for Medish, I'm just putting facts as they are. He had an insurance by Medish. The insurance did not cover a single euro, just because Medish do not cover pre-existing conditions. Another thing, another example, a client of ours, aged 67, he got a Medish insurance from the Millennium Bank. The thing is that this product, it's called Medish Vintage, does not cover expenses above a very certain tiny limit of 200 euros when it comes to ambulatory care. So he could not perform an MRI through an insurance that he thought he had. And this is the main thing out of this short story, what not to do. Please, when sitting in a bank or sitting with your insurance broker, don't do this. Oh, just sign here and here and here and here and you will have an insurance. Don't do this. It's not a trap. Nobody's trying to fool you. But take a deep breath. I know that everybody is excited and sometimes stressed to have a health insurance. So take a deep breath and do two simple things. One of them, that's the letter that I'm mentioning here. You can be a Portuguese. Nobody in Portugal expects you to take a decision on spot. No one. It's okay to say, you know what? Thank you. I appreciate your proposal. I will take it home and read it. And then take it home and read it and talk to somebody who understands health insurance. And another thing, if you really are eager to sign for a medical insurance, if you really are eager to get it over with, ask one simple question. One, only one. That's the winning question. And this is, how will this policy that sir or madam that you are proposing to me would serve my needs? It's a very simple question. You don't have to memorize it. It like comes naturally. And if the answer is, well, it's a good one, it's the wrong answer.
Yeah.
It's the wrong answer, because your insurance policy is supposed to serve your needs, not the needs of the bank, not the needs of the broker. Very simple question. And if the broker or the bank do not know how to adjust this specific proposal to your needs, it means they did not hear you. They did not ask you what you need, and what you're about to sign does not match your needs. This is very simple. Just memorize this very simple question. How does this policy serve my needs?
Michael, may I jump in there? Because this is great.
Absolutely, because this is what I asked you to do, right?
Yes, indeed. I think that's great. You know, that cultural insight there, be Portuguese about it. And you don't have to say no on the spot. And we do understand why people do get panicked and reach for a solution, because they think it will take away the pain, right? That's one less thing to worry about. I've signed the insurance paperwork, often the one, I did this myself when I first arrived in the country, the one you get offered by the bank. And I didn't ask that question that you've so eloquently put there. Will this serve my need? It served one need. I had one need, which was I'd like to be able to speak to somebody in English on a helpline. And they said, yeah, you can do that. And that was good enough for me. Now, that was a need, not plural here. How will it serve my collective needs? And that's a family at the time with 2 kids. So I did need to be a bit more conscientious and thorough. And you're absolutely right. So I think if the answer is don't know, that is not good enough, is it? Does it meet my needs? It needs to be broken down. And are you saying that you can help people in breaking down the terms and conditions? Because we know certainly our partner, Nuno Mendes, Insurance, can help with that. But between the two of you, presumably, you can break it down and make sure that it meets the needs of the individual.
Absolutely so. Nuno is a great guy. We love him. We work with Nuno very, very closely. The thing is that what we do is match between the proposal on the market that we already know. It's not very, very complex, but you need to know what you're doing, with the practical medical needs of a person. Yeah. And guys, again, your medical affairs, your medical concerns are yours. You can share it with a medical professional. And this is what you find, by the way, with us. You should not share it with the people at the bank, or even with your broker to a certain extent. I mean, you cannot obscure that you have some medical conditions, but when it comes to something very, very serious, and again, you know what? Another example. This is real life example. People ask us a lot about insurance with a major concern that they bring from their own culture and their own background. This is totally natural. The States, as an example. Mm-hmm. I have insurance because the expenses on my medications are tremendously high. I can't pay for it. I will lose my house if I have to pay for my medication. And this is why I'm buying an insurance in Portugal. That's the wrong reason. If this is the only reason, because medications in Portugal, for sure, those that are expensive, would be provided with no connection to your insurance. So if you're stressed and you just need, and you know that you will need a very expensive medicine, and this is why you're buying today your insurance, you're buying the insurance because of the wrong reason. Mm-hmm. Your medications will be provided anyway through the SNS, through the national healthcare system. And this is exactly the thing I'm saying. Like when you sit in front of your bank clerk and they offer you the best insurance ever, and you ask them, okay, but why is it good for me? You say, well, okay, but my concern are medications. And if they don't know and they can't explain how medications work in Portugal, you're in the wrong place.
Yeah. Yeah.
So don't sign. It's okay. The bank guy or take it home, think about it, ask friends, ask us, ask Nuno.
Yeah.
take a wise decision. That's it.
Yeah. And I did hear today, actually, talking to somebody, that they were excluded. They thought they bought themselves in exactly the same way, actually, Michael. They thought they bought themselves a very comprehensive policy for coverage of the mum, in this case, a family policy. She fell ill, and there was an exclusion, I think, of 360 days of any serious condition. And that is quite a grey area, isn't it? Because this is an elderly lady, so they could argue that any condition she might find herself in at that age would be serious for her, and they were not going to pay up on that insurance policy.
Yeah.
So I think it's
and that's the major problem.
Yeah, it was a different company. It wasn't Medici. It was a different one. So this, as you say, it's not personal to companies. You just need to know what you're dealing with when you get into these situations. Thank you very much. Yes, do carry on.
All right. So this is something for Sophia, right? This is yours.
Okay.
Yes, it's mine.
Welcome.
Yes. Welcome. Hello. Just I'm here to try and talk to you about a very specific case about serious diagnosis just before departure. I'll try to give you a very specific example without coming into much details. But sometimes you start your trip and nobody expects that anything is going to go wrong. So you put everything in your suitcase, you take care of everything, and then you start your journey. You put yourself and your family in an airplane, and all of a sudden, on your way here, something happens. And in this case, this was a family. They had small children, and one of the children got sick during the travel. So the decision for all of us who are or aren't parents is always difficult to understand is, what will we do? Do we go back? Do we cancel everything and you just go back and wait and see what's going to happen, or no? Or do we continue this process of this journey? For this family in particular, they took this decision. They decided to continue their journey and come to live in Portugal. What is important to know in this case, and it's very important, is do your research. Even if you're on your way here, even if it's a completely unknown and a very scary situation, do not forget to do some research. After taking this decision, go with it, accept it, and just go forward with it. There's certain things that you can do even when you get here. You can you can ask and appeal for staff, for example, to anticipate the appointment for medical reasons, for important medical reasons. This is something that they will accept, and this is something that you can do, that with a medical diagnosis with the correct information. This is something that you can do. Also, you will need at least a temporary SMS number, a temporary enrollment in the public services, because for this types of situation, and especially if we're talking about children, there's always this special attention, and you know that we try to be at least the word in English is escaping me. we try to be more worried about children and elderly people. So this is something that more people will be attentive to, and it's going to be easy. And then who will be the appropriate specialist for this? So you have a situation, a serious situation, so you will obviously need a specialist for this, and the right one, the one that will be waiting for you for this first appointment when you leave the plane, and will be with you, will be helping you and holding your hand. So it's important. First of all, it's a decision to go back or to come. It's something that people can do. There's no rights or no wrongs. But the importance in this case, for this real story, is they did this decision and they took these steps. They did the research. They end up contacting some places. They end up arranging some help. And so in certain ways, everything went more or less smoothly on something that could go very wrong, and that could be very, very, very difficult for a young family and for someone that's changing here their whole lives. And so the idea is this, our advice is this, is again, take a step, take a deep breath, and take this decision. Should I go, or should I come back and go? Should I come back to my home country, or do I go to Portugal? Because we have good specialists, we have good medical care. You just need to know where they are.
Well, so far, Sophia, you've underplayed your role in this, because I think you were quite, you know, it sounds here like they did all this themselves, but I don't think a foreigner coming to this country would stand much of a chance, especially under those stressful circumstances, to do all of that. And you assisted in this way, right?
Yes, we try to assist in this way, and we try to arrange for all of this.
Yeah.
But it's very important that people be comfortable. What I want to, it's important to be comfortable with your decision, and it's important to say, okay, I make this, because there's always rocks on the way. It's not a smooth, and it's not an easy path. There's always little walls and little rocks and little stones on the gears of the road. So it's if you're comfortable with this decision, and if you're okay with it, and if you trust the people that are here to help you, I think this is also good. And this relationship that you can create, it's very important. Good. Especially it's a trusty relationship. It's very important.
Sure. And you've mentioned the temporary SNS here. We do need to decode the acronyms here. For
yes.
and also say, I mean, this will come as a godsend, even though some people don't know that yet here. This will be an utter godsend that you can help with and I think Michael mentioned it before, but the UTENT number, the SNS number. Can you explain what that is and how you can help with that at this stage?
Basically, SNS stands for Serviço Nacional de Saúde. So it's the service, the National Health Service. It's the part of the health system, the Portuguese health system, that belongs to the public sector. So it has all the cares, from primary, secondary, tertiary care, but within the public system. For that, because we Portuguese love numbers and love to identify people by numbers, you get another number.
Yeah. You already have your NIF number at this point.
You already have your NIF number. Yes. This is the first thing you got. Then you have some other numbers that you will have, but this also is a very important number. So it's the number that says that after you are a resident or a citizen, in our case, if you are born in Portugal, if you're a Portuguese citizen, you get it once you were born. If you're a resident, usually you get it once you have your self-appointment and your residency cards. Because of COVID, I don't want to be too boring, but I tend to be, because of COVID, we needed to do temporary SNS numbers, especially to be able to administer COVID vaccines to people that were just here temporarily, or we needed to do this. So they created this temporary SNS number that now they just give it to everyone. What happens is, most of the times you are very happy, you still don't have your self-appointment, but you're very happy, someone give me an SNS number. And then you go to use it on your doctor, so he writes you a prescription, and he says, I cannot do anything with this. So this is the bad side of this number. Okay. What it helps you with is, when you have these complex medical situations and you really need attentive care and you really need to get into a hospital, this will help you either way. Right. This is like, it's important when you have this complex situations, and for this can be very helpful, because this is what we need. You need to register someone in the SNS. We need to get him into a hospital, the right specialist, to the right treatment, and we need it really fast, because it's something that's ongoing. And especially when we're dealing with children and more complex situation, it's important to do this. Yeah. And so this is what we try to do. Yeah. Okay.
So it's important to have the SNS number, the UTENT number, it's also known as, and it sounds like there's an acute and a chronic version of it. So you're going to get one, and Serenity can help with that. But for longer term use, you're going to need your official and permanent SNS number at some point.
Yes, okay. It's another step. Once you get your residency card, you get the one.
Okay. Yeah. All right. Perfect. And then this part of looking for a local appropriate specialist, this mightn't it, that they are in the public or private sector? Because sometimes with some conditions, the specialists belong in the public system, and you can make a call with Serenity, for example, to say, okay, actually the best person for this, although, you know, it's counterintuitive in a way, the best specialist might actually be in the public system, which is funded favorably in favor of this particular specialist, and then vice versa. Actually, in this particular situation, the public system's a bit slow. You're better off seeing this kind of specialist. And no foreigner is going to know that from their own research, I suspect, right?
Yeah, because people tend to separate the public from the private, and we have a very mixed system. So the doctors travel between systems, and it can help. It can happen like another example in this happens. Someone goes to an appointment with a doctor in the private sector. He sees the results, he sees everything, he sees, and he says, oh, you know what, for this particular situation, I really want you to go to the public hospital. So I work there. So wait for, I will send you the information about the exams you have to do in the public, and then I'll follow you there, and you probably will do your surgery there. So, you know, this is an example of what can happen. Even though you went to this appointment privately, the doctor sees the situation, and sometimes he can do this and see, okay, this seems like something that we need to deal with in the public system, because this problem can take 2 steps, or it goes really well, or it's a complex situation, a serious disease, and I want you in the public system. I want you there. I want you to have all your medical care there.
See, it's the other way around in the UK. they trade you up into the private system. Anyway, thank you very much for the time being there, Sophia. We've got some lovely questions coming in. We will get to all of these this evening, and we will have the open mic session, as it were, if you want to ask questions after the recording is finished for public purposes, and you can ask more personal and private questions at that point. Lovely feedback as well already. We have somebody, Lois, who signed up with Serenity and has had some great, and you've been called rock stars, I think, as well here. I'll come back to that. I'm just trying to find this earlier comment. So many questions are coming in that I'm losing now. But Lois, thank you very much for your positive comments about Serenity. Oh yeah, signed up with Serenity just before moving here 3 weeks ago. So you can sign up before coming. Marta and Estenio have already been a great help. So that's very reassuring and good to know. Great feedback there. You'll have noticed tonight as well that Jerry's not here, but Jerry says that he joined Serenity himself. And I think this is for public sharing. Hope so. And he joined Serenity to find a new general practitioner that was local to him in his part of Portugal, and who also spoke good English. Serenity found him a great doctor, and in advance of the first appointment with the doctor, you arranged for a full set of lab tests to be done so that you could bring them to the new doctor and speed things up. In fact, this resulted in the GP prescribing some new medication right from the get-go. So Jerry, a happy customer as well of Serenity. Sophia, thank you very much for the time being. I think we're moving on now on how to save money. I think people are suddenly moved forward on their seats, Michael.
Yeah, it's not about saving money, just not spending money.
Oh, okay, fair enough. That's good.
Which is quite the same.
Yes.
And this is another thing of kind of just open your ears and listen. Okay. Both apparently both systems, public and private, in Portugal would be happy to have your money. This is an exciting news. Yeah. Actually, the last example was pretty surprising for me as well, but it very well goes with the Portuguese mood. And the Portuguese mood, by the way, sometimes it's not because somebody wants to really rob you, but sometimes people make their own interpretation of something that was written or something that they have heard. So, guys, here are 3 short stories of how not to pay when you don't need to pay. The first one belongs to Sophia because that was with her, and she was the savior of the money of this poor guy. So Sophia, it's back to you, and I'll take the other 2.
Okay, back to me. Yeah, continue with the conversation a little bit, trying to get you with the SNS number and everything. One thing you need to know is within especially the primary health system, when you go to the public health center and talk to your GP, there are no charges No one can charge you money for that. Not for that, not for the exams that the doctor will prescribe for you, whether it's a colonoscopy, a mammogram, or just blood tests, because they're done within the public sector. What happened in this particular case is that everyone took one look at the person, and because he wasn't Portuguese and because he didn't speak Portuguese, even though he had an SNES number, even though he had a residency card, someone just decided to stop the appointment and say, oh, wait for it, you're not a resident, you don't have a social security number, so go back and get one, so you cannot be here. And they charged it 35 euros for the appointment that didn't wait until the end of the appointment, and they charged their money for that, and they just paid. And so what I have to say to you is, don't pay. Do not pay. Do not, especially if you have a residence card that's given to you by CEF that says that you are a resident in this country. So you have the same rights that all other residents and citizens in this country, and you have an SNES number. So everything applies to you also. Do not pay any money, and you do not need a social security, because you're not going to have a retirement here, or if you're not working, social security is some other things. For more than 10 years, then the social security number is not needed to get an SNES number for more than 10 years. I know that sometimes the updates don't come all the way to every part of the country.
Yeah, that's a long time. That's a long time to not get a memo, though, isn't it? 10 years.
Yes, and no one can say that I don't know the law. This is also something that in Portugal you cannot say, oh, I don't know the law. It's not something that you can say. So do not pay if you go to a public primary care, the Centro de Saúde, how we call it.
Yes, yes.
Primary care do not cost any money.
Very good to know. Thank you. Very, very clear and very helpful. Thank you for that. Did he get his money back?
We're still working on it.
Yeah, excellent.
We're climbing the ladders. We are already at the regional center. We asked for an audit to the place, so we are climbing the ladders. I don't know.
Sophia, not boring at all. Costa, you described yourself as boring. I mean, I would like you on my side if I was in that situation. Great work. Back to you, Michael.
Yes, thank you for that. So and that was a true surprise for me as well. Like that's the first time that somebody on the public sector wanted money, but it happens much more with the private sector. So here as well, another story. We had a client with an insurance in place. She had an emergency. She went to a private hospital. She was diagnosed with an acute medical condition that actually urged a surgical intervention. So it's a rapid flow of events. And then what happens, and again, this is, you know what, I'm not saying it's from bad intentions, but it's, I'm just using the situation. And the situation with the expats is very, very simple. They come with two major plastics cards. Okay, two major plastic cards, sorry. One is the card of the insurance, and the other plastic is much more valuable, called Visa. And the hospital just tells you, okay, so look, like, okay, we have the insurance, we will contact the insurance and we will talk to them by, hey, it's middle of the night, so we don't know if they will answer. Do you have Visa? Yeah, I have Visa, I have MasterCard, I have everything. Okay, give us this as well. It's just a deposit. And then you walk into the emergency room, you've been processed, and yeah, you need the surgery right now. Believe me, folks, it's much faster, much easier, and much safer to charge your plastic with the name Visa on it. And the only thing that actually the receptionist has to do now is to communicate with your insurance company and say, hey, Mr. John Smith has an acute situation and we need your authorization to operate him. Actually, you have insurance. This is exactly why you bought your insurance. It would actually never work with a Portuguese person because a Portuguese person doesn't have on his visa X amount of money. With expats, it happens more often. And then you say, okay, so like, so how much do I have to pay? And they say, well, it's only 6,000 euros. And you say, okay, whatever, I need a surgery. 6,000 euros seems like a nice price for a surgery. If you compare it to the States, for example, you say, no problem, charge my visa. Don't. Because the only thing that the receptionist has to do is to contact your insurance company. And yes, he has to sit on the phone or he has to go on the platform and fulfill some process and whatever, but then the insurance will cover it.
Mm-hmm.
Unless you say, go ahead, charge my visa. Please don't pay money. This is why you have insurance for, this is why you presented the other plastic. Insist with the clerk there, no, sir, with all due respect, no way I'm paying from my credit card. You talk to the insurance. And if the insurance doesn't answer, no problem. It's, by the way, side note, important side note. When it's about an urgent situation, okay, an urgent or an emergency intervention, if it's an appendix that is about to explode, the insurance will pay for it. There's no chance you're not covered, at least partially. Mm-hmm. So it can't happen like, don't accept somebody who says, the insurance didn't answer. It doesn't happen as well. If they didn't answer, it's not your problem. It's a problem of the hospital because you are insured. It's faster, less work, less worries, and less responsibility if I can just charge your visa.
Yeah.
Don't do it. You will have to give your visa, yes, because there's a deposit. There's something, you have a copay, you have some fee to get into the emergency room, but that's it. Okay? Don't pay until the hospital, the reception, whoever it is in the clinic did not complete the process with the insurance. And if they say the insurance denied, ask to look at it.
Okay. Very good to know, Michael. Very good to know indeed. Yes. And okay. And you can back people up with this because, you know, sometimes when you're not feeling very well, you might not be quite so assertive,
I agree.
Right?
I agree.
Yeah.
Give us a call.
Okay. All right. That's good to know.
Now, and the second thing, the third point here, the third bullet is exactly the same process, but under a different circumstance.
Yeah.
You need a surgery. It's not an emergency, but you really need it. And you go to the hospital and they say, well, no problem. So we scheduled your surgery for next Tuesday. But, we already sent the proposal, the surgical proposal to your insurance company. They just didn't answer us. So look, if you don't want to lose your spot, your window of opportunity in our distinguished operating theater, you have to pay private. So no, I'm not paying private. If you, dear hospital, want my money in a way, my insurance company's money, call them. You call them because you are supposed to collect the payment for my procedure. So, and they do it all the time. By the way, they do it all the time, and normally they would overcharge you because we know, unfortunately or fortunately for our clients, we know the backstage. And the backstage is very simple. When you have a surgical proposal, there's an estimation of costs. And this estimation of costs normally starts with, I don't know, the true cost plus 35, 40%.
Yeah.
And then they call you and say, well, the estimation of cost is, I don't know, whatever, 8,000 euros. So please just deposit it and then we will do the calculation. Don't deposit anything. You say, talk to my insurance company, please. Talk to my insurance because this only when they talk to the insurance company, there's a final quote because the cost of the surgery or the cost of the procedure is totally different if you pay privately or you pay through the insurance company. Insurance company has better rates. So actually the final price and hence your final co-payment will be only calculated when the insurance approved and said to the hospital, what is your percentage of co-payment? If you agree early in this process to pay, nobody will talk to your insurance. You already paid, all good.
Yeah, that's a very good point and very useful. Thank you for that. And you've reiterated or highlighted something for me there. Is when I started my insurance policy, I was given the plastic card, and I thought, why do I need this? It just seemed, like a bit unnecessary.
Plastic.
I've got a policy. Yeah, why do I need to this? So it's very important within this particular culture to have that card to present in these emergency situations, so that people know which company they're dealing with, and so that they can engage with the insurance company. And that's the important card. Again,
Yep.
instead of the visa. Okay, that's really good to know.
Not only this, you have your policy number there. So when they put it on the platform of the insurance, or they talk to the insurance to say, hey, I have one Carl here, his policy number is da 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 da.
Keep those cards where they need to be, folks, for these particular situations. God forbid they happen, but when you need them, that's when that card is all important. The other thing you said as well, Michael, is it's not necessarily that people are out to get you, is it? It's just that in some ways it's easier, and maybe some people are incentivized in these hospitals to go for the money. It's not personal, it's not nastiness, it's just an easier thing to do sometimes. In the same way that the bank clerk will be incentivized to sell you the health insurance policy. So they'll just be doing something that gives them extra money or some extra points at work. Okay, interesting to point out a cultural thing there. Okay, let's move on.
That's a good one, but I think that this is Rafaela's. This is Rafaela's client.
Rafaela's been waiting very patiently. Over to you.
Can you all hear me?
Very loud and clear.
Good. So I'm going to give an example of how we can help, and a little bit of our work as well. So this is just a very usually example of something that can help. And in this case, it was a couple that they were like my clients, and they subscribed to Serenity before they arrived to Portugal. They have been I was with them. We did like our initial call before they arriving to organize everything they need and how will it go. I explain everything as well. So in this call, I always try to understand the past medical history. So I knew that this was a couple. They were quite fit and well. They were quite a 60-something couple. So nothing to worry at that moment. So then they arrived to Portugal. And they say, Rafaela, we are here. Everything is good. We are glad to be here. A few days later, one of my clients, one of them, talked with me and said, Rafaela, something is wrong. It's just some pain, nothing special. I'm not too worried, but I just want you to be aware. Can you maybe help me? And we spoke. I said, okay, 10 minutes and I will call you. We spoke on the phone. And it was nothing special, at least didn't look like nothing special, but I was worried. It was my clients, I knew that were fit and well. Maybe it was just the stress of arriving to Portugal, the new food that is delicious. And and I said, okay, let's see. And I'm going to also speak with my colleagues because we are a team, we work as a team. And I turned off the phone, I spoke with my colleagues and with Michael. And we were like, okay, this and this, and what should we do? Michael also called him, also spoke with him, did some changes, said, okay, let's try a healthy diet and see how it goes. Everything was, he said, okay, maybe I will try the new diet, just be careful and let's see. During the weekend, this was Friday, during the weekend, again, he spoke with Michael, he was still not feeling quite well, and things were just still not okay, but nothing special apparently. So on Sunday, I think Michael spoke with him again and said, okay, I'm not very sure because this is just a phone call. So what I think you should do is just to go to a doctor, but a doctor that we trust. We can find you an appointment for tomorrow with a good doctor, with someone that we know and that we trust. What do you think? The client accepted, and on Monday we booked an appointment for him, and he did go. And it was a doctor that we knew and that we speak in the phone with them because it's a clinic that we are quite comfortable to work with. And the doctor said, well, I saw the patient, but maybe the patient should go to emergency room. And she organized everything for him. She explained what the client should do, and he did go to emergency room, and actually was quite a serious thing. and the patient needed to be there and he needed to be hospitalized. In all of this, I think you can see the support that we can give. Imagine for this couple, they just arrived to Portugal. They don't know how anything works and something just did go wrong so suddenly. I think it's to feel that you have someone that is there for you, I think is so important. And then this client was hospitalized, but there's still a partner that is outside not knowing what is happening and that also needs support. And then it comes all the bureaucratic issues with insurance and what to do and not what to do, and we also help with that, and we also try to give our support. So I think it's very clear how we can help. I think it's that this is like one example, and in this case, then the person it was the charge, and now I keep like doing the follow-up, and I'm keeping like helping with reschedule the follow-up appointments and physiotherapy and all of that. But I think you can see how we can help and how suddenly things change.
Absolutely. And I'm loving that intuitive approach there, which is quite rare in the world of medicine these days. You had an inkling by the sound of it, and shared that with your colleagues, and you found out that there was indeed something at the bottom of that, and you were able to help that person. That's fantastic, Rafaela. Thank you very much. I think we might be going back to Michael now. And Michael, we have been talking for 40 minutes now, and I think it might be useful to take a few questions. Will I be stealing your thunder too much if we go to a few more questions, or would you like to do one more slide?
No, go ahead. Go ahead. I think that we
Okay.
should dedicate some time to questions. The last cases by, again, the two case managers, but I mean, you're the boss.
We may do a part 2, of course, and go into more case studies, but we have people who've joined us tonight.
That's the last one.
Okay, go on, go ahead. Go through that, and then we'll go to some questions.
So let me just verify. I think what Rafaela said, she was too humble.
It's often the way I've noticed with the Serenity.
I like
Serenity, yes.
I like but it's not about us being like, hey, we did a miracle. We didn't do anything.
Yeah.
We didn't do any heroic part. The only thing is, and this is the takeaway from this, you need somebody that you can trust and can communicate within themselves. All of what Rafaela said is very important. She mentioned it several times. The guy did not have any alarming, obvious symptoms. It wasn't a chest pain with a radiation to your left arm and cold sweat. This is easy. The fact is that Rafaela knows this client is a super healthy guy. Something there didn't go well. Something didn't go well with her. It was her hunch that drove us to do something kind of doesn't seem right. Mm-hmm. And this hunch of something is wrong there drove us to send him to a very specific physician that we trust, that we know that she's like us on a distance. And she had the same bad hunch. And when the whole group had a bad hunch, something is there. And this bad hunch led us to send this particular patient to an emergency room. He was diagnosed and he was hospitalized with actually a life-threatening situation if it wasn't treated on time. And that was it. We didn't do anything special. Nobody was a hero, but we just worked as people that trust each other and a client that trusted us. He trusted our small hunch that something is wrong.
That's very good. Yeah, no, but I think it's right. The having talked to a few of the team now, I do think you're quite humble actually, and not undervaluing your service exactly, but yeah, very sort of kind and humble people. And it's quite right that you illustrate how powerful and useful that is tonight, Michael. So what are we looking at here on the screen?
So that's the last one, ladies. Please take it.
Yeah.
Okay.
So in here we also see a bit like what we do when we are trying to look for someone, for a physician, for one of our clients.
Okay.
We always try to make sure that is the right location. And when we ask people, please, maybe can you go a little bit further, is because we trust someone. And maybe we ask, okay, maybe it's in your city, is the city next to you, but maybe it will be very useful. But we are always like making sure that is the correct location and is like in an area that the client can go. And besides that, we always try to make sure that it's someone that we trust. And even if we don't know, we look at the CV and we look at the recommendations and if they have good reference. And obviously something that we always make sure is if the physician speaks English, and we always try to find someone that also works with the insurance of our clients to facilitate all the process and just to help.
Okay, brilliant. The essence of case management and concierge there. Fantastic. Okay, let's get, people have been very patient. You've been brilliant. Michael, Sophia and Rafaela, let's take the screen, the presentation off for the moment and take a few of these questions. And I think you'll probably rotate on answering these according to your specialism within the Serenity team. Okay, so who was first asking a question? Actually, one that came up just towards the end there, which is quite an important one on emergencies. Are you available 24/7? Presumably not.
Sophia should say the no. I'm just saying yes.
What happens then when this is Allegra's question about are you available let's say in the middle of the night and you're in an emergency situation, you want some backup from Serenity? Can that be done?
So look, what really happens is the following. We are not, and this I have to admit, and this is not humble, this is the reality. We are not a substitute to 112. We're not a substitute to the local 911. Okay, we do not really work 24/7. We are literally available more or less, for sure, 7-11 or 610 or 611, something like that, because somebody is awake in relatively early morning, and we have lots of channels of communication. We have the general email, we have WhatsApps, everyone, we have phone call, we have phone numbers, etc., etc. So no, we're not 24/7. But if something happens in the middle of the night, and of course, at 3 a.m., even Sophia and Rafaela are sleeping, I hope. But if you are in the emergency room, send us a message. I'm here. I found myself in the ER. I didn't feel well. I'm here. So just call me when you see this message. We will call you when we see this message. Believe me.
Good to know. All right. How are dental and vision care addressed in the Portuguese system? Sometimes, yes, people, and I know by just mentioning social media, Michael, you may scoff because of all the misinformation. We talked about misinformation on social media last time. But I think it is right that people are concerned and they hear horror stories about the provision for dental and optometry care. Is that the right, or ophthalmic care in Portugal? How does that work? Could you give us a view on that from Serenity's point of view?
Yeah, it's the realistic. It's not exactly Serenity. Look, the fact is that everybody, for sure, coming from the States, are preoccupied with vision and dental. First of all, dental. Dental has a coverage, not a very big one, in practically every comprehensive insurance policy that you can buy in Portugal. Don't expect their big capitals. They will move between 500 to 1,000 euros if they exist. And that would be enough for the routines, cleaning, fillings, maybe a root canal, maybe it's small emergency, you broke a tooth or something. So this is covered, again, partially. If you're expecting to make a big orthodontic work, implants, etc., it will not be enough. Okay. This is dental. Vision. We have to define here, or actually divide the vision into two sides of it. Everything that an ophthalmologist, an MD, a doctor specializes in eye care can do will be paid through your insurance. In full, this is covered by your ambulatory care expenses, clinics, etc. Whatever concerns optometrics, meaning getting your glasses, getting your frames, different insurers would provide you with the different coverages, a small couple of hundreds of euros. It will be more or less enough for one pair of glasses once a year, or a little bit of contact lenses.
Yeah. Okay. All right. And sometimes a discount as well operates, doesn't it? In fact, some people confuse discounts with insurance. That's another thing to be careful about. You might be sold what you think is insurance, and it's actually a discount. So be very careful with that. As we said right at the start of the webinar this evening, be very careful. Is it meeting your needs? Is it what you're asking for? Do you understand what you're buying? Okay, this is a great question, which I'll generalize. Thank you, Alison. How do we fill an ongoing medication prescription that our US doctor prescribes? So the handover, how is this managed generally? You must be seeing a lot of US clients now who come over and they don't want a break in their prescription. They want to find the right drugs as well. How is that working?
Do you want me to go, Michael?
Thank you.
Yeah, this is a very common question about the prescribed medication in the pharmacies and how do they work.
Yeah.
Most common medication will be available in Portugal the same way, in Europe the same way that there's in the US. There is certain types of medication that is not available. Medication that comes from animal substance, that the product to make it is an animal product. They're forbidden in the European Union. So usually in Portugal, you will not be able to find it. And there's medication that usually in the US are over the counter, and here you need a prescription for it. So this is also a difference. And then there are controlled substance that need very specific types of prescription. They're controlled substance, so you will need a doctor to prescribe to do the prescription a certain way, and you only get access if the doctor prescribes that way. So it really depends on the type of medication that you're bringing, and this is always important to check before you come, because you may need to do some readjustments even before you come. And there is information available, but we are always here to help with that. And this is a very common situation that we deal with every day.
As in continuity of medication. Okay. And Lois, as Lois said, signed up with you before moving here. That's possible. And so the case management can occur before you even set foot in the country, which is great. Thank you, Jeff. I'll come to that later, your question, because it's quite specific, Jeff. Jeff with a J and then Jeff with a G. We'll talk about the S1 and some of the UK situations after the recording's finished as well. Michael asked, can tourists purchase travel insurance through Serenity? That was answered by Rita. Thank you, Rita, who's also here tonight. To get travel insurance, we would advise you reach out to Nuno Mendes from Winsurance. You can find Nuno in our business directory, expatsportugal.com. As well, of course, the link to Serenity. The usual question that we end with, as well as thanking you very much, at least for the recording here, is how much does this cost, please? Who's going to answer this one, Michael?
I'm talking about money. They always leave me to that.
Michael!
It's quite a symbolic price, guys. It's 180 euros per year per person.
Okay, there you go. Nicely nailed there. Thank you very much indeed, Michael. Thank you, Sophia. Thank you, Rafaela. We will go to those specifics. I'm sorry, says Allegra, I should have been specific. I realize you're not 112. So how to go about getting guidance on best how to proceed regarding location, best clinic, etc. We will address that after the recording is finished, which will be now, so we can go to those more personal questions. Do be here live for the webinar. If you want to make sure your own questions are answered in future, sign up at expatsportugal.com. Thank you very much. For now, Michael, Sophia, and Rafaela, I think it's a bit of a round of applause there. Thank you very much indeed.
Thank you, guys.
Thank you. Thank you.